Barb, I hope you don't mind me taking a side curve here real quick, but I couldn't help but get attracted to your book, Depression Hates Movement, but
Mhm.
mostly because of the fact that it was on the bestseller list for bipolar and running and jogging. Almost two different things, but yet I could see how they could tie together. Can you talk to us about how they tie together?
Well, for me, movement and especially running, because that's my love, is a treatment for my bipolar disorder. It's one of the tools in my mental health toolkit. I mean, I have therapy, I have medications, I have meditation and writing practice. But when I added breaking a sweat through movement to the mix, it really changed a lot of things. And so that's how that first book came about. Was I started running at 48, 49, and it surprised me. I mean, it really surprised me. I did not expect it to make the kinds of changes that it has. I was on 4 medicines, and now I'm on a very small dose of one.
Wow.
I don't have to see a therapist as often, except when there's a difficult situation.
Hmm.
And yeah, I just feel more stable. I was able to get a book published by a traditional publisher, which I had not been able to do. I tried that with a number of other one book in particular, but so it just really changed things in so many different ways. And I know now that there's tons of science behind it. It's not a great surprise to most people, but it was to me.
Okay. Well, I'm just going to follow up. I think it might be a great surprise to a lot of people. I mean, we think bipolar disease has to be treated because of the chemical imbalance with medication.
Yeah,
So I
and
think
mine
that makes a big difference.
Yeah, mine is. And we're always careful to watch for any mood imbalance that might require an additional medication, especially a mood stabilizer. That's usually the most common one with bipolar that is effective. But right now, I'm on a SSRI Prozac. That's just what I'm on. And for whatever reason, it is working. The movement and the meditation and all the tools. I never know which one's working at any given time, so I try to do them all and try to keep
Oh,
them
okay.
all in play. But yes, I have excellent. I'm so grateful for excellent mental health care professionals, because not everybody has access to that, and I have good insurance, which not everybody has. So I'm very, very fortunate. And I never want to say that movement is a cure, that movement will fix it all. Oh, just stop going to therapy, stop taking your meds. No, 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 no. We did that very gradually with professional help. It was not, needed
Mm.
just winging it, which
I
people sometimes
imagine,
does.
you said you do all the tools. You just keep doing a little bit of everything, and you're not sure which one is working at any one time. I'm sure it's some combination. I have a
Mhm.
feeling though, the movement, since we're just talking about that part of it, probably makes you more aware. Now you said you go see your therapist when you need to in a situation. So do you think your movement, or your movement and your meditation, brings you a heightened awareness of when you need additional support or different support?
I think you're right. I think the meditation gives me the focus, but because I use it primarily, I meditate while I'm moving.
Okay.
That I do think that combination though does bring heightened awareness. And with movement, I'm a runner, and so there is some precision with it, but it's not like weightlifting or ice skating or some other sport that might require the type of intense focus. Now, when you're racing, that's a whole different thing. That does require the intense focus if you really want to do race at a high level. But for me, I think the meditation is probably the part that gives me that self awareness. I probably am just a naturally proprioceptive person, which also helps. And I think the term is highly empathic, but I'm just very aware of
Okay.
my emotions, other people's emotions. And so that that probably helps me be able to reach out and willing, which that's another piece, because with medications there's sometimes side effects. I've gone off them, gone back on, cycled through, and now I'm very willing to trust that my psychiatrist especially will listen to me, and that the things that she says will be helpful, because that's not, not everybody feels that way either.